Hello, everyone. My name is Peter Lonergan. I'm the communications lead with BC Healthy Communities. We're just going to give it another minute or two. I'll kick things off with a land acknowledgement. But while we wait, I encourage you to kind of type in, use the chat, let us know where you're from and the territory you're on, if you know that. And we'll get started here in a few moments. Thank you very much. All right, everyone. I think we'll get started now. People can join as time goes on, but we'll kick it off. My name is Peter Lonergan. Again, I'm the communications lead with BC Healthy Communities, and I wanted to welcome you here today to the Creating Healthy Public Policy with Extreme Heat Planning with Northern Health. And we'll kick this off. 1 second here. All right. I'm joined here by Jody, who is our ED of BC Healthy Communities, as well as Melissa, who's on the back end with doing some question stuff, who works with us as well. It's great that they're joining. We'll also have Jeff Kormos, as well as some speakers that will be joining us in a minute. But to start things off, I wanted to do an acknowledgement. BC Healthy Communities members acknowledge the surrounding traditional lands of the Kasapsum and Lekwungen nations, where we work, live, and learn. The agenda today. So I'll talk just briefly about BCHC as well as Plan H. I'm going to then pass it to Jeff Kormos from Northern Health, who is going to talk about the presenters as well as healthy settings. From there, the presenters will talk about the extreme heat concerns, actions and responses to extreme heat concerns, and then we'll wrap up with questions. As we kick off, just a couple things to note. This is being recorded, so just so you know and you're aware. Also, if you do have questions, please use the Q&A function that'll be on your Zoom. Put any questions in there. We're going to address those at the end. If you want to ask the specific speaker, you can put their name in there as well. But I'll tackle those and kind of direct them as they come in. All right, perfect. So BC Healthy Communities, we're a private province-wide not-for-profit facilitating the ongoing development of community health and for healthy people. You know, it's just we at Healthy Community Society believe that it's possible and necessary to create communities where it's easy for citizens to be healthy and well, and we operate at the intersection between planning and public health. We support Plan H. Plan H has been around since 2012. It's for local and Indigenous governments. It supports local and government engagement and partnerships across sectors for creating healthier communities. It provides learning opportunities, resources, and leading edge practices for collaborative local action. It's a partnership with the Ministry of Health, and it supports the province's health promotion strategy. Healthy public policy in this series. I just want to spend a moment and talk a little bit about public policy and its role in local government. Plan H has been focusing on HPP for the last few years, and because it's such a powerful tool and resource for local Indigenous governments to create conditions for thriving and equitable communities and ultimately improve the lives of community members. What's most exciting about it is that it's a pathway to create systematic change and that we know we're going to need to overcome the challenges that we face. So today we have a few presenters from Northern Health. We have Paula Tate, Dr. Abigail Steinberg, and Jeff Kormos from Advisor from Northern Health, who's going to host from their perspective. So I'll pass it over to you now, Jeff.
Thanks, Peter. Hello, everyone, and thank you for joining us today. My name is Jeff Kormos, and I'm an advisor in the Healthy Settings program at Northern Health's Population and Public Health. Before we get started with today's presentation, I'd like to briefly describe the Healthy Settings team and the work that we do. We're a regional team with advisors for each health service delivery area, the Northeast, the Northwest, and the Northern Interior, and a community granting coordinator. Our tagline is, we connect, we facilitate, and we fund. Next slide, please. Our mission is to work with communities in northern BC to influence the conditions that promote well-being in the social, natural, and built environments. We do this in a variety of ways, not limited to funding healthy community development initiatives, connecting local governments and community organizations to provincial and health authority resources, and facilitating capacity building or information sharing initiatives such as this webinar. I'm personally fond of working with decision makers to encourage more health in all policy type approaches to local policy making, and very interested in increasing healthy public policies throughout the North. On the last slide, there is contact information for your regional healthy settings advisor and our community granting coordinator. Please do not hesitate to reach out to any of us with questions, concerns, or project ideas. The next slide, please. It's my pleasure today to introduce today's speakers. I think we're missing a speaker slide here. First of all, I'd like to thank our friends at BC Healthy Communities for hosting this webinar with us and providing the platform and infrastructure to conduct this type of event. It is no small feat. A huge thanks to Jody, Peter, Melissa, and the whole team at BC Healthy Communities and Plan H. Our first speaker, Paula Tate, is the technical advisor on the, our second speaker will be Paula Tate, a technical advisor in the Health and Resource Development Program, and is a member of the BC Heat Committee. She's our local expert on both air quality and extreme heat risks. Dr. Abigail Steinberg is a resident medical health officer at Northern Health, and her interests specifically in health equity and the social determinants of health lend themselves nicely to planning for extreme heat events and mitigating the negative human health impacts. I would like to thank them both for taking some time to share with us this really important information, as extreme heat and related events are occurring more frequently and for longer durations in our region. Dr. Steinberg, if you are ready, take it away.
Great, thanks so much, Jeff. So first, I'll be starting with some background around heat and the health effects of heat to provide a little bit of context for what we'll be speaking about today. So extreme heating events are the leading weather-related cause of death in Canada. And last year, we experienced record-breaking high temperatures in Prince George and throughout much of the North and Western Canada. Prior to the heat dome last summer in June of 2021, the previous extreme heat event experienced in BC was back in 2009. Last summer, there were 619 deaths attributed to extreme heat events between June 25th and July 1st, what we call the heat dome of last summer. And most resulted from excessive indoor temperatures in private residences. Next slide, please. So why is this an issue in the North? The poles of our planet are actually warming much faster than the equator. This phenomenon is called Arctic amplification, where the loss of sea ice and snow cover enhance temperature increases. We have also been historically less adapted to or prepared to extreme heat in the North. Next slide, please. So what is extreme heat and heat-related illness? So heat-related illness is the result of your body gaining heat faster than it can cool itself down. It can almost always be prevented. I think that's an important point to emphasize. In severe cases, it can lead to heat stroke, which is a life-threatening medical emergency, also known as sunstroke. Next slide, please. So what are the symptoms of heat-related illness? So we can see from the list here that symptoms can range from mild to quite severe in nature. So from pale, cool, moist skin and heavy sweating, all the way to the severe end of the spectrum with seizures and unconsciousness. Next slide, please. And here's a great infographic from our friends at Fraser Health Authority. And this slide breaks down those symptoms into two categories: heat exhaustion and heat stroke. Anyone experiencing symptoms of heat exhaustion should be moved to a cool place, given plenty of water. For anyone experiencing symptoms of heat stroke or sunstroke, we should be calling 911 for immediate medical assistance, as this is a medical emergency. And we know that older adults, infants, young children, people with chronic conditions, and people on certain medications are especially sensitive to the heat effects, to the health effects of heat, and should take extra precautions. Next slide, please. So there are several things that contribute to heat vulnerability. And here we've organized them into 3 categories: physiological, social, and environmental. So physiological characteristics include age, any pre-existing medical conditions, an acute illness, specific medications and drugs, and acclimatization to heat. Social characteristics include reduced access to cooling facilities and other heat mitigation measures, for example, air conditioning, social isolation and barriers to reaching out for help, and socially vulnerable groups being more likely to live in neighborhoods with environmental vulnerability, which then leads us to our last category of environmental characteristics, which include sparse vegetation, darkly hued roofing and paved materials in the neighborhood, lack of cool neighborhood spaces, and what we call urban heat islands. Next slide, please. So this list is actually a screenshot from the coroner's report that came out of the devastating effects of the heat dome last summer. So again, emphasizing some of those folks who are especially susceptible to the health effects of heat. As I've already mentioned, age is certainly a factor. So we think about seniors age 65 or older. People who live alone, as I mentioned before, most of the deaths last summer were in folks who live alone. People with pre-existing health conditions, this can include a longer list, but includes diabetes, heart disease, or respiratory disease. People with mental illness, for example, schizophrenia, depression, or anxiety. Folks who use substances, people with limited mobility, people who are marginally housed, those who work in hot environments, people who are pregnant, and infants and young children. Next slide, please. And again, touching on the medications and drugs that can affect the risk of heat illness. So this is not an exhaustive list, but some medications and drugs that can increase vulnerability. So this includes antihistamines or decongestants, some of the antipsychotic and antidepressant medications, diuretics, anticholinergic agents used to treat a wide array of conditions that may include asthma or Parkinson's, anti-epileptic agents, so for folks with seizures, beta blockers, which are used for blood pressure management, and then drugs like alcohol, cocaine, amphetamines, and more. So again, not an exhaustive list. Next slide, please. So as I alluded to previously, the BC coroners put out a review of heat-related deaths in BC in the summer of 2021. And this yielded several major findings listed on this slide that have led to some major pieces of work in heat preparedness around the country. I'm sure many of you, if not all of you, have had a chance to at least skim through this coroner's review. And I recognize it's a bit small on the slide here, so sorry about that. But I'll just highlight a few of these points. So first, it was found that 98% of deaths occurred indoors. Also, there was a lag between the heat alerts that were issued by Environment and Climate Change Canada and the response by public agencies. And heat deaths were higher among those on specific chronic disease registries. Also, 67% of those who died were 70 years of age and older, and more than half of those folks lived alone. So I really want to highlight here that in many cases, folks who are otherwise vulnerable experienced the majority of the morbidity and mortality during the heat dome last summer. So this highlights the need to include a specific focus on equity deserving populations in our approach to heat events. Next slide, please. Perfect. So 3 key areas were identified to reduce heat-related deaths. Again, this came out of the coroner's report. So first, a coordinated provincial heat alert response system. Second, ensuring that vulnerable populations are identified and supported during extreme heat events. And third, implementing prevention and longer-term risk mitigation strategies. So now I'll hand it over to my colleague Paula to talk more specifically about how these key areas have been actioned for this summer season and beyond.
Hi, everyone, and thanks a lot, Abby. So you may have already heard about the new provincial heat alert and response system, the BC HARS. A variety of professionals from epidemiologists and doctors to meteorologists and emergency responders came together to develop a heat warning and extreme heat emergency alert system for people in BC. The province is broken up into different geographic zones with different temperature criteria for triggering alerts based on typical regional climate and adaptive capacity to handle heat stress. Next slide. There are important distinctions to be aware of when comparing heat warnings and extreme heat emergencies. Heat warnings are issued about 1 to 3 times per season, and heat emergencies are issued about 1 to 2 times per decade, so a lot less frequently is what's forecasted for now. The event from June 2021 was considered a heat emergency. We may see a 5% increase in deaths during a heat warning, but a 20% increase in deaths from a extreme heat emergency. And this is why it's important to have heat plans prepared in advance of these events for a variety of settings. These plans will save lives. Individuals, support agencies, municipal governments, and communities all have roles to play. Next slide. Rural and remote communities face unique challenges when protecting people from extreme heat events. An effective heat alert and response system in the rural context relies on leveraging existing social networks, local knowledge, and extensive community outreach by proponents to ensure buy-in from the whole community. In fact, before the provincial HARS was adopted, the village of Ashcroft developed a community stakeholder committee comprised of local and regional government partners, community members and organizations, and First Nation band members to collaborate on extreme heat solutions. We fully recognize that tailored and creative solutions are needed in smaller, more remote communities. Next slide. There is an extensive list of recommended actions in the BC HARS document for various planning and action phases. The recommendations are meant to support planning from a public health perspective as capacity and funding permits. We recognize that not all of this can be implemented at once, and some actions may not apply or be feasible in some communities. Examples range from plan development, identifying those most susceptible to heat, community outreach, revising local bylaws during heat events, cooling centers, wellness checks, tracking lessons learned, and emerging needs assessments. If we can identify who in our communities are most susceptible to the effects of extreme heat, we can work collaboratively to identify local planning and response strategies. Next slide. I'll briefly touch on some important guidance for individuals. Temperatures in the range of 31 degrees Celsius and greater are very dangerous, especially for those who don't have air conditioning and cannot escape the heat in their homes overnight. Many people don't have a way to monitor indoor temperatures. Fans can be counterproductive for older people at serious risk because they improve the perception of comfort without reducing the core body temperature. And fans can be placed strategically to push hot air outdoors and cooler indoors during the night when temperatures come down outdoors. Next slide. Prepared BC has some really great guidance to help people plan for extreme heat. Even knowing where reliable information can be found or having a plan for where to go to escape the heat are some great first steps. And next slide. There are a variety of risk factors here regarding the built environment and extreme heat. And some of those have been touched on already environmental risk factors. Incorporate ventilation, air conditioning, green spaces, and water features, green and reflective roofs, and cool pavement surfaces. We can start to see how adaptive strategies for heat will require many stakeholders coming together and working collaboratively on key priorities. Next slide. Again, once risk factors have been identified, there are actions that can be taken to prevent illness and minimize risk. If fixed or portable AC is not available, then locking cooler air in during the day and venting hot air out during the night can be effective. Cooler areas of the home or building can be used. Northern Health has a recent blog post called Extreme Heat, Budget-Friendly Ways to Prepare Your Home. But using a variety of communications channels will be essential for reaching our most vulnerable populations, and radio is still an effective way to reach certain populations. Next slide. So many risks and vulnerabilities that apply to extreme heat also apply to smoke events and complicate interventions such as the recommendation to open windows. Heat is a larger health risk than smoke for most people, so cooling should be prioritized before clean air. But obviously, cool, clean indoor air is the best bet. Next slide. Some homes will not be safe during heat events. Therefore, providing other safe, cool spaces is important. People need to know where they can go, and making the space inviting and accessible will boost benefits. Again, this is where collaborative planning approaches will really help. Hearing stories from and lessons learned from those with lived experience using cooling spaces is another great strategy to ensure that we know how to make them low barrier and accessible. Next slide. There are a variety of supports or funding opportunities listed under the Community Emergency Preparedness Fund that I recommend you check out. And health authorities can support communities looking to apply for grant funding supportive of health-based initiatives. So again, leveraging that collaborative planning endeavor. Next slide. And health authorities can also help navigate the lists of resources available for climate resiliency and preparedness planning. Some examples are listed here, and I think they'll be provided in the chat as well. Again, the Prepared BC Extreme Heat Guide, Health Canada Heat Alert and Response Systems to Protect Health, Irreversible Extreme Heat Protecting Canadians and Communities from a Lethal Future, and Lived Experience of Extreme Heat in BC. Next slide. And some more resources here are from HealthLink BC, Beat the Heat, the BC CDC Heat Event Response Planning, and this is where you'll find the BC HARS document, the Health Canada infographic, Staying Healthy in the Heat, and fact sheets, and then strategies to mitigate the impacts of extreme heat events among homeless populations in BC's Lower Mainland, a review of evidence-based approaches and recommendations. And next slide. From folks around the province to put into this presentation. And our colleagues here, Dr. Raquel Kling, Jeff again, and Fraser Health Authority, Vancouver Island Health Authority, and Interior Health Authority. And here are some contacts.
Thanks, Paula. I would like to just reiterate that the Healthy Settings team is here to help
For
you.
Healthy Settings, department mentioned their role is to help. Yeah, thanks, Jeff.
Sorry, we're cutting in and out here. I'm sorry. Yeah, just to reiterate, Healthy Settings is here to help you navigate resources, information, and otherwise help you and your community plan for extreme heat events and mitigate the negative effects of the negative human health impacts of heat. Our personal and general contact information is on this slide, as well as our community granting coordinator's contact information. The vacancy in the Northeast should be filled this fall, so please do not hesitate to reach out to any one of the advisors, and we will connect you with resources and information that you seek. We are also keen to work with you on this and any other healthy public policy related projects. Thanks again to all our participants for joining us today.
All right, well, thank you very much, Jeff, Paula, and Abigail. There are a few questions that came through the Q&A. So I'll address the first one probably to Jeff and or Paula, but to Jeff, and it's a broad one, but how do you prepare for wildfires and smoke? Or are there resources that you use to prepare for them?
Yeah, it's a good question. You know, we've got a lot of experience in Northern Health preparing for wildfire smoke, and you know, a variety of messaging that we have ready to go for media inquiries, that kind of thing. We've put out community letters regarding planning for wildfire smoke with recommendations. You know, I participate with some groups and can share information that way with community groups. And so, you know, the heat portfolio is a lot the same in that, you know, those existing partnerships can be used to share information, and, you know, the provincial resources are a huge help as well from the BC Centre for Disease Control. And so, yeah, a lot of the wildfire smoke resources are there, and also the extreme heat resources. So lots of similarities between the two. And obviously, as I mentioned, the extreme heat is more of an acute, you know, priority when it strikes. And so prioritizing staying cool is really important versus, you know, the longer term impacts from smoke.
Perfect. Thank you very much, Paula. Chelsea, if that didn't answer your question, type back in. I'm happy to kind of follow up with that, but we'll move on to another one that we got, which was, this will probably be to Jeff as well, is, are you aware of any networks or groups that are collaborating on heat emergency planning or doing similar work currently?
Yeah, and I think I can take this one again. As I mentioned, there's some air quality, there's some airshed groups across the north, like the Prince George Air Improvement Roundtable. There's a new group in Kitimat Airshed Group, and those are really great venues for, again, for community action and getting multiple stakeholders together to discuss tricky issues locally. There's also some climate resiliency groups, one in the northeast of the province, one happening now called North Can across the north, getting stakeholders together. And so even if extreme heat specifically isn't the only topic at the table, those are great venues, and they've proven very successful for tackling some of these really complicated issues.
Thanks, Paula. I'll just add that most of the response in the north has been very localized. So where you have, like in Prince George, there's a community safety hub. Many of our communities still have like healthy community planning tables or healthy community committees in one form or another. And those are great ways to sort of bring all of the stakeholders together or all of the partners together and think about how to set up a cooling center for the vulnerable, or which agencies have the ability to set up, you know, cool spaces for people to be at during those extreme heat events and heat warnings. So there's quite a lot of local response, and Healthy Settings is definitely here to help think about setting up those responses, or to help communities who are struggling to do something like that. Thanks for the question.
Perfect. And we'll go to one more. It's what is your approach to wellness checks? Are there resources to help ensure that the most vulnerable are protected? And can you elaborate on those resources?
Yeah, certainly. I'd be happy to take this question. So I see that we put in the chat the National Collaborating Center link for a health check during extreme heat events. So I'd encourage everyone to check out that link. Around our approach at Northern Health, so throughout the summer, so earlier on in the sort of heat season, we have been working with HEM-BC, Health Emergency Management BC, our northern group, to present at various tables. So these are folks within the medical community, so medical directors, the divisions of family medicine, other folks who engaged with some of our most vulnerable populations in the north. And we've given a similar presentation where we're talking about a bit of the background and why certain folks are more vulnerable and how important those health checks are. So it's been kind of a season of really educating our medical community and asking from them as well how they best see us approaching reaching out to those individuals who often live alone, have sort of small social circles and things like that. So it's been a really a great opportunity for everyone to kind of learn and work together. And so what we've seen so far is that folks who are vulnerable and at risk of heat-related illness and negative outcomes have been often getting wellness checks from many different sources, which we would rather sort of see this redundancy than folks being missed. So it seems that we're approaching this from different angles, whether it's through various care teams, through chronic disease registries, just all the different contacts that folks do have. But would also encourage you to think about how folks can be checked up on and supported in your community, even just yourself individually, thinking about family and things like that, and create plans. So again, just steering you toward that link that's in the chat, just the sort of second last comment in the chat. Have a look at that, because that's a really great resource that we use as well.
Thank you, Abigail. So we have a couple more questions that we'll tackle here. And one of them is, how are you planning for long-term heat events, such as long-term in 20 years, that type of scope?
I can take a first stab at this. I think it's a really great question, and luckily the Ministry of Health and health authorities are looking at climate change resiliency planning at that provincial scale, and compiling a strategy to address some of these big risks that we see coming 20 years down the road. And so part of that is to do a vulnerability and risk assessment at the health authority level, at the community level, at these different levels, to really understand, okay, what are those risks 10 years down the road, 20 years down the road, that kind of thing, and have somebody with experience in doing this kind of assessment identify those risks to start with, and then again using that more local collaborative approach to identify how those risks can be managed and mitigated at the longer term scale, I think is where we can start.
Thanks, Paula. I'd like to add, I think in terms of a community response, thinking about this in terms of future iterations of the official community plans, those are great documents to start to consider what, obviously climate change effects down the road, but having hotter summers and longer durations of hotter summers and how that's going to affect us. I think there are very local things that we can do to make those considerations and to to help us guide community development towards mitigating those risks in the especially in the built environment, but also in the social environment. So I think that's an opportunity that we can definitely work together with communities to do, or communities can take that one on and run with it.
Perfect. And we have one more question from Pablo here. It's any local examples of projects or collaborations you know of that are taking action to reduce the environmental vulnerabilities?
There are some, like locally in Prince George, there's the Community Energy Association is working on planning to mitigate and adapt to climate change. There's a climate change table in the Northeast. I'm sorry, I don't have this information right in front of me right now, but that collaborative approach, I think, is the best way to go about it. And I think there are, to be fair, we've been a little bit slower in the North at working towards climate change mitigation and adaptation. But those tables are out there, and they do exist. Yeah, I can, if you really want some concrete examples, you can get a hold of me by email and I can direct you to some of those tables specifically. I just don't have that information with me right in front of me.
Perfect. And just one more final question, just to kick it off, because it all is about equity as well as, and one of the questions that came in is, what steps can we take to ensure we are applying an equity lens to these decisions and policies?
So I can start this one, and then we'll welcome Jeff and Paula to continue. But just highlighting those folks that we know are more vulnerable to the impacts of heat. So as I sort of mentioned at the beginning of the presentation, there's a really nice list that's been put together in the Corners report, but also maybe quite specific to your community, to an individual, and folks may have a combination of characteristics that may lead to them being more vulnerable to those impacts of heat. So I think for us to really just ensure that we're keeping that lens, that heat does not impact everyone the same way, and recognizing that these can be additive as well. So individuals who may be marginally housed, for example, are more likely to live in areas that are more experience more environmental vulnerability. So with fewer green spaces, with less access to cooling areas, and things like this. So I would just really encourage us to ensure that we're keeping in mind that heat impacts everyone differently, and there's a lot of different characteristics that play into that. And then I'll pass it over to Jeff or Paula if you have anything to add there.
Sure, thank you, Dr. Sandberg. I think each community has service organizations that provide care services for some of our most vulnerable or marginalized groups of people, and bringing those people into your local planning will identify where people need, like where the need is to protect vulnerable people, or where to provide those services, where they can get out of the heat and into a place that's safe. So I think really that whole of community approach of casting a really wide net and trying to bring as many different groups to the table as possible to talk specifically about how do we protect our seniors who live alone, how do we protect people who are homeless or underhoused, how do we protect people who are suffering from substance use disorder or entrenched street life, that kind of thing. So the wider of a net you can cast in your planning, the more of a view you'll get of all of those groups that we've sort of discussed in this presentation that need a little bit more thought into how to protect them. I hope that answers the question.
Perfect. I just checked the time. We do have time for a couple more questions. So right along those lines is who are those that are the most vulnerable in the north? And is it different in the north in the remote communities?
Yeah, so I think, I'm sorry, Jeff, I'm not sure if you wanted to start.
No, go ahead.
Okay, sure. So yeah, so I think, you know, while we certainly have sort of unique needs and a unique sort of spread of folks in all of our different communities, we did see, you know, throughout the really devastating impact of the heat dome last summer, that there were some very clear indications of who is most vulnerable, who is most at risk. So again, I'll just reference sort of the list, and I had a few lists kind of at the beginning of the presentation. I know we ran through it quite quickly, but hoping that folks will have access to the recording or the PowerPoint. But those who live alone, the older folks, folks who have various comorbidities, folks who are on certain medications, you know, folks with decreased mobility. These are some of the things that can impact vulnerability and how folks will respond to heat. And again, we can see that one individual may be impacted by multiple of these characteristics, so that can increase individual risk as well. So, you know, it's important to identify who those folks may be in our community, even within our own, you know, social circles and things like this. And that's where we're emphasizing those wellness checks.
Yeah, thanks. I'd like to add, you know, it's hard to point to exactly who it is. There's so much diversity amongst communities. But there is, you know, again, utilizing local outreach, those tight community networks, that's where you're going to find, they will tell you who they are, right? When it comes to making sure you care for the most susceptible to the negative human health impacts of an extreme heat event. So just to really push that idea this is a thing that takes I think a whole of community approach to plan for, to make sure that you can, you know, equitably plan for an extreme heat event in your community, and make sure that everyone in your community is safe, whether they have access to a home with air conditioning or not.
Perfect, thank you. And then we have one last one here, and that is, what are your next steps in planning ahead for extreme heat events in the north? And what do you tell communities, or what should they look for to move forward with heat planning?
I can take a first stab at this again. I think, you know, the next steps in terms of extreme heat planning are just to make sure that, yeah, we understand, you know, regionally, which communities may need support from us from a health perspective. You know, it's something that we've done in the last several months ago, I guess now, but we had a student project where they reached out to 5 different communities with a climate resiliency survey asking about cooling centers and clean air shelters, and we got a really some really great feedback from that pilot survey. And you know, a next step could be to expand that survey out to all of our communities in the north, for example. Also, you know, just again, using the, you know, finding out how the BC HARS system is rolling out, and understanding, you know, any challenges that communities are experiencing with that resource or tool specifically, and, you know, how those can be addressed. And so just being very adaptive and responsive to, you know, what we're hearing in terms of, you know, how heat planning is going in each community. and understanding, yeah, those issues.
Perfect. Well, thank you very much. I want to give a big thanks to the speakers today for taking the time to give your expertise. Also, a big thank you to everyone for joining. It was really interesting to see everyone from Invermere to New Zealand to Richmond, BC. So that's always neat to see as well. So thank you very much to Jeff, Paula, and Abigail. We really appreciate it, and thank you.